Hello. Thank you for taking the time to watch Impacting Emergency Department Bleeds. The Change is Here and Now, which has been designed to meet the educational needs of emergency medicine physicians, hospitalists, and intensivists who are primarily responsible for the management of anticoagulated patients with severe bleeding. Throughout the program, Dr. Gregory Furman and Dr. Brian Gibler had walked you through content and education associated with the learning objectives. Those objectives were to recognize and distinguish major from minor bleeding, recognize that any intracranial bleed in the setting of anticoagulation is potentially life-threatening, distinguish which bleeds can be treated locally versus referred to a specialized stroke center, distinguish when and how to use renal function tests versus coagulation tests in determining whether to use a DOAC in emergent situations, review key considerations and recommendations associated with reversal agents for DOACs, and employ treatment and management strategies incorporating new therapies for intracranial bleeds based on an understanding of the mechanism of action, benefits, risks, dosing, monitoring, and management of these agents. Learning how to utilize agents like idarucizumab and andexanet alfa in treatment emergent situations to reversal anticoagulation in the emergency department or ICU are critical in the overall continuum of care in a hemorrhaging patient. Understanding how the management of a bleeding patient is within pre-hospital setting when the EMS unit commonly becomes involved where basic hemorrhage control takes place, and obtaining a medication list to going to a destination hospital where continuation of resuscitation and volume expansion and blood pressure support take place, beginning to embark on site of hemorrhage, and finally getting to a higher level of care where the appropriate course of therapy and management can be completed. Knowing the capabilities of one's own emergency department, but also the consultants and ability to transport patients are critical in optimizing the outcome of such bleeding patients. We thank you for your time.